pick up your little green paper, baby. When you get to the test and you're doing this case study, this was put this way by design. Remember I said it's going to be 6 questions in one case study. So your question number 1 is always going to be based on you recognizing cues. So once you know that, you stick with the program. And if that's true, look at what recognizing cues means. What does it mean in your Oh My God packet? This what I want you to do for this. Write it down. Look at every number in the study. Maybe they say 3 hours. Maybe they say 20 minutes. Maybe the number is vital signs. Maybe it's the time of day. Perhaps it's how many kids she has. Maybe it's how many times she's been pregnant. Look at all numbers. It's definitely the age. That is the first step of analyzing any Nclex question. Look at all numbers. That's part of recognizing cues. Because when they said she was 42, in my mind, I was like, that's a cue. Let me write that down because she's a millennial. Okay, so it does matter. Okay, so that's good, babies. So when you look at your first part of, mine is yellow. When you look at your first part of your case study, you can see that it's going to say question 1 of 6, and then question 2. Question 2 of 6 is where you now start to analyze the cues. What do they really mean? Do they play a role in how you're going to figure stuff out and what you're going to do first? What's going on with this lady? What's going on with this man? So you know I always give you the same example. Let's try it again. Let's say that in the recognizing cues, you had a 16-year-old female coming in with pelvic pain through the ER. Are you still with me? Yes. In your analysis of the cue, you should be saying to yourself, she's an adolescent. She's childbearing age. Female. Oh, could be pelvic pain, could be anything with a pregnancy, ectopic, STD. You analyze them damn cues. Recognizing simply was understanding she is 16, picking out of the mix that she was a female, picking out of the mix that pelvic pain will impact your decision this whole time. You see how that go? Okay, now you're prioritizing hypothesis. You're trying to figure out, well, what the hell's wrong with her? So on the third one, you will see question 3 of 6 is usually asking you to decide what kind of diagnosis does the patient have. Okay, in this case, left-sided versus right-sided heart failure, whatever. So when I look at the test and I look at different things that they like to put in a case study, in this situation of you trying to prioritize hypothesis, that would be where you trying to decide ulcerative colitis versus Crohn's, osteoarthritis versus rheumatoid, placenta previa versus abruption. You see where we're going? Similar conditions. That's how they did it. The baby said it earlier. Neuroleptic malignant syndrome versus serotonin syndrome. That's how they do it on Nclex. They put 2 things that sound enough alike to see if you know them well enough to pass this test. Okay? All right? Now, you're generating solutions. Let's look at what it says here. When we're generating solutions, this is perhaps the hardest part of the case study. Here you're trying to think of what you would be doing as a nurse, and I need my babies to highlight basic care and comfort. On your Oh My God packet, highlight that basic care and comfort, because that damn sure is part of your generating solutions. I want you to highlight the word precautions, because if you put the patient under bleeding precautions and seizure precautions and ICP precautions and dysphagia precautions, infectious disease precautions, neutropenic precautions, that's what generating solutions is. False precautions, all of that is generating solutions. Identifying their pain level, generating solutions. Teaching all day, generating solutions. Okay? So that's a little different. You really got to know that, all right? That basic care and comfort, ice packs, cool packs, warm packs, cough and deep breathe, all that. Okay, now the take action is usually related to like first nursing action, saving the life actions. What kind of actions will stop this from getting worse action? So if you're thinking about an asthma attack patient, your taking action would be give a breathing treatment in O2, right? If you're thinking about a shoulder dystocia action, your take action would be fundal pressure, right? I mean, suprapubic pressure. If you're thinking about a prolapse cord action, your action would be making sure that you know to prepare for a C-section and elevating the lady's pelvic or putting them on hands and knees. Knee chest position would be optimal. You see where we're going with this? What action did you take to save the life or minimize the deterioration? Okay, so that is going to be number 4. Now, number 5, I mean, that's going to be number 5, you're taking action. Your number 6 is kind of weird. On the test, a lot of times, this is a verbal situation. It is asking you to choose between some comments that the patient made, which comment by the patient shows they understand, because included in evaluating outcomes is discharge teaching. Okay, so don't be surprised if you've got a bunch of quotes and you have to choose which one is making sense. So it is discharge teaching, it's making sure they don't get worse, it's safety issues, it's making sure you know what would happen if they're getting a complication from that disease process. Okay, so all of that is so important. So, you know, it would be a situation where, did you realize and understand that the pre-eclampsia patient is now saying my stomach hurts really bad, and you understand that if you were to evaluate that outcome, that means that the complication of abruption is happening, because everyone knows that an abruption is a complication of preeclampsia. Okay, so let's get at it. We know what to do now. We got it. We're going for it. Let's do our little case study. Now, the name of this case study is not a, a Grey's Anatomy. This is not from Grey's Anatomy. It's just a generic case study that I made to pretty much mirror the ones on the test, like really mirror them. So let's go ahead and get started, shall we? Now, so this is your